COVID-19 can be characterized as a pandemic.
4 years after that declaration from the World Health Organization, COVID is still on many Canadians' minds.
It doesn't feel like it was 4 years ago, but I mean, I'm happy that we are where we are.
I think that was a very powerful impact on people's life.
I just don't want to get sick. I got races to run, so just can't get sick.
Researchers say staying up to date on COVID vaccines remains one of the best ways to protect yourself. And a new American study suggests more frequent vaccination for high-risk populations like older adults and anyone immunocompromised could help reduce the burden of severe illness.
It becomes less about the number of doses you've gotten and more about the time since your last vaccine dose or infection.
The study's co-author says protection wanes over time, leaving higher-risk groups more vulnerable.
If you just look at the data on severe disease and who's being hospitalized and dying right now, it's almost the same pattern that's been present the entire pandemic. And I think that's quite striking.
Canada's overall COVID death rates have dropped dramatically since 2020. But older age groups are still bearing the brunt, with 9 in 10 total deaths among those aged 60 and up.
I think we'll see new guidance.
This Canadian immunologist expects a spring vaccine push here for higher risk groups, since COVID is still circulating year-round, at least for now.
I suspect we'll get to a place where it's more seasonal than it has been.
Scientists do remain hopeful that COVID will become less of a threat over time, but for now, it's still sending some Canadians to hospital and leaving others with lasting health impacts. Official guidance from Canada's national vaccine advisors: high-risk Canadians can get another spring dose. Lauren Pelly, CBC News, Toronto.